Is Ezra Klein. Ezra writes a blog on economic and domestic policy for the Washington Post. Also joining us here in the studio, Congressman Anthony Weiner and CNBC's Maria Bartiromo. Good to see you both again. So, Congressman Weiner, you heard me express a little skepticism about the Obama or even the broader Democratic approach about whether or not they've been aggressive enough with insurance companies and with big pharma in the end. And I understand that in some ways they've wanted to cut deals, but the reality is that if we come up with a plan, we're still going to have serious costs involved here because we haven't looked to take an even bigger chunk out of those major cost centers.
Well, look, they're not doing anything venal. They're doing what businesses do. They're trying to take in as much money as they can, pay out as little as they can, return as much profits to their shareholders. We have some experience with the private model. Medicare Part D, rather than making it part of existing Medicare, we gave about $730 billion to the insurance companies and say, come up with a prescription drug plan. Have you ever heard of the donut hole? Have you heard of limits on coverage? Well, now it's a $1.1 trillion program, and citizens have big gaps in coverage. So we know that just giving more money to the private insurance companies doesn't get us there with cost.
So why aren't we being more aggressive? You've got savvy people in the White House, including Rahm Emanuel and David Axelrod, not to mention the 44th President of the United States. Why are we not being more aggressive?
I don't know if we're not being more aggressive. You know, I reduced Joe Scarborough to a quivering mass talking about this not long ago. Some of us are being very aggressive about it. But the question is, can you kind of cut a deal that the insurance company likes? Well, they're not going to want to give up profits. But I think what you've got to say to them is this. So listen, you're going to get all these millions of new customers that right now are going to hospital emergency rooms. Again, they're going to go to one of your plans. But the deal has to be you've got to pocket a little bit less in profits per person. You've got to bring down your costs some. That's where the competition part comes in. And frankly, it's a bit of a bank shot. You and I know that I believe in a single payer plan, but that's the philosophy. Right now, none of the Republican plans have any cost saving. They say tort reform. We have tort reform in 46 states. Not a single one has had insurance rates go down.
I just don't believe the cost savings. I mean, I still don't understand how it is we're going to get 47 million additional people under the umbrella, and even if it's the same amount of doctors, and make it cost less. You say that, but I mean, maybe the Republicans don't have a plan, but it's like, what are the details? How do you actually get there?
Here. I'll tell you how we get there. Right now, Medicare gives about $650 for a hospital bed. If you're in a hospital bed, they give $0 for a preventative care to have someone in your home for $50 to come in and try to keep you out of that home. Right now, Walmart provides $4 pharmaceutical drugs. How do they do it? They take a huge pool of consumers and negotiate for a very low price. Does Medicare do that? No. You get more people under the government umbrella who then can negotiate for lower prices, and that's what's going to wind up happening. It's called competition.
The government to run their health care.
Well, stop that. Stop that. The government run their health care. Your doctor and your hospitals run your health care. The question is, who's going to hand them the money? Right now, if you have a problem with your Oxford insurance, what do? You buy shares in the company? The question of who you want to run it is a mythology.
Well, see, that's another thing that I take issue with. This idea of class warfare, us against them, business is so bad. I mean, the fact is when you say shareholders, who are the shareholders? They're pension holders. They're mutual fund holders. I mean, there are 100 million people who are invested in the stock market.
Hold on a second. First of all, I just said to Carlos, they're not doing anything wrong. They're not being venal. They're doing what they're supposed to. My job is to stand up for the taxpayer.
Yeah,
someone else's job. Someone else's job. Look, if someone was charging the federal government $700 for a toilet seat, but that company was doing great as a result, you wouldn't say, oh, it should be $800?
No,
you'd say that's not a good deal for the taxpayer. That's who I'm here to fight to represent.
Someone else. We're going to leave the investor.
This is good. I'm liking this debate, but we're going to leave it right there. Right now, we're going to take a quick break. For more on the hot button issues that we're talking about today, check out our website. Go to carloswatson.msnbc.com. We'll be right back. You're watching MSNBC Live.